And so it's only appropriate, I think, that we stand back for a moment and acknowledge the work of our faculty in this area. And here in particular, I'm delighted to be able to present awards today honoring excellence in advising to faculty members who have dedicated themselves to mentoring, supporting, and guiding our students in their work overseas. This is an important form of recognition, Tom, that you've brought to our university. And I think it's a wonderful way of, again, celebrating the expertise at the university, but also the firm determination to transmit that expertise to the next generation, to mentor, but to mentor in context abroad where we know that our students are really able to develop and hone their skills. Now this year, there were 34 nominations from 4 schools and faculty selected by the awards committee. And I'm going to ask people, as I announce their names, to come forward to receive your award and then remain with us at the end so we can call the other awardees and then get a photo or video shot that will be there for all posterity. And so with that, I am wondering, Tom, if you could join me at the podium so we can recognize and award these colleagues. Dr. Matthew DeCamp, General Intern Medicine Fellow in the Johns Hopkins School of Medicine. I'm wondering, Matthew, if you could come down. The student who nominated him wrote, "From our first meeting, Dr. DeCamp displayed an exceptional dedication to helping me achieve my project goals. We worked together to design the project, choose the location, contact local physicians, identify a local IRB institution, and draft and edit an IRB proposal. While I was in country, Dr. DeCamp was working here in the US to make sure I got approval before the project interview started. Upon my return, we met numerous times to go over data analysis and prepare for my presentation in January 2013. Dr. DeCamp, congratulations. Wait a second. Dr. Jonathan Golub, Associate Professor of Medicine and Epidemiology. The student who nominated him wrote, come on up here. Jonathan, we should stand, clap. We're just trying to get, we're iterating this. We're getting this right. Okay. Jonathan is an excellent scientist and a fiercely dedicated mentor who consistently promotes the work of his students and is committed to matching students with meaningful springboard projects that are not only excellent research opportunities, but set his students on trajectories to continue research in their field of their choosing. This is a unique combination, and I'm truly grateful to Dr. Gold for making my PhD experience educational fun and a launching pad for my career. Congratulations. Dr. L.A. Leoncini, Senior Associate in the Department of International Health. The student who nominated her, well, you heard from her in a moment ago. That scream was her, I imagine. Dr. Leoncini has gone above and beyond in his advisor. She has sat down with me and listened while I tried to determine what to do with my life. You think you might be available to help me out later on?
Me too.
Yeah, no, I asked first. Watch it. And subsequently provided me with numerous opportunities so I could explore where my interests lie. Among my many colleagues, I'm envied for having Dr. Leoncini as an advisor due to the care she provides to me and other advisees. She is someone that I've depended on to help shape my academic path and personal journey through Hopkins. Dr. Leoncini not only cares, there's more, I've got another 5 pages. Not only cares for advisees, but also her many other students. She is a leading mentor in the Department of International Health. Congratulations. Dr. Alexander Vu, Associate Professor of Emergency Medicine and International Health. His advisee, I spoke out of turn here. I said associate. That is to come. It's assistant right now. but there's something in the room, something out there that... His advisee wrote, "My advisor took the trip with me." That's just, I'm not sure we'd want to talk about this in a context outside of this one. there could be so many other places in Baltimore where that wouldn't go down as well. My advisor took the trip with me. Not only did he mentor me on the technique of qualitative analysis, but most importantly, he was there for me when I was feeling overwhelmed by the very sensitive topic of identifying male refugee survivors of gender-based violence in Uganda. He did a great job of counseling me and debriefing with me. Most importantly, I was impressed that he put my safety considerations as the highest priority. I was impressed at how well he was able to balance my education with the research project. Dr. Wu, congratulations. Dr. Keith West, Professor of International Health. His advisee wrote, "Keith is such a nice and generous advisor that I cannot ask more from him, but I will." He has a very busy schedule during the day, but he managed frequent meetings with me by scheduling appointments, Skype calls after his working hours. Keith generously provided guidance and funding for me to present my work at the Food and Agricultural Organization in Italy, a great opportunity and experience that would not have been realized without his encouragement and support. Keith is an extraordinary mentor, not only because, as an advisee, I've learned so much from him professionally in the field of international nutrition, but also personally, I've learned so much from him about how to be a human. Dr. West, congratulations. So all here is there. Ow. Oh.